So we also want to talk about some classroom challenges that students on the spectrum may face, and the effects it has both on the student and on the classroom and the teacher. So students with autism typically need a little more time and assistance from their teacher, and how much time they need and how much attention they need is really dependent on the severity and their place on the spectrum. And students with autism can find a lot of tasks that are classroom related difficult. Planning, management, organization, participating in assessments, negotiating learning tasks, so knowing what the teacher is asking of them if it's not stated explicitly, and homework taking. These can all be really difficult for students on the spectrum. And there is a way to kind of improve student learning. Tablets and laptops have empirical evidence to support that they improve student learning on the spectrum. But unfortunately, these aren't really mainstreamed in our classrooms, and so it's difficult for students without appropriate technology who have cognitive or motor skills to engage in their assignments because it's just extra difficult for them. I want to talk about a personal experience that I have with autism, and it's a secondary experience, it's not my own. But my grandfather is one of the leading researchers on autism research and developing curriculums, not through the education department, but developing methods and programs to help integrate people with autism and Down syndrome into mainstream society. So my grandpa received his PhD from UCLA. His name's Gary Galbraith. He received his PhD from UCLA, and he's a neuroscientist. So he immediately after he received his PhD went to Lanterman Developmental Hospital to continue his research. And Lanterman Developmental Hospital is actually a developmental community in Southern California. And in the 70s, it was kind of a dumping ground. It's a terrible thing to say, but it's true. It was just a dumping ground for people with disabilities. There was just such a small amount of research available about autism and about how to help people with autism, and so parents with children with developmental disabilities like autism would send them to Lanterman. And it was my grandpa's goal when he got there that he was going to help these students get back out into, not students, but these people get back out into the world. And so his specialty was speech and sound recognition. I'm not entirely sure. It's probably got a much more complicated medical and scientific term. But he worked really hard on helping those people that had communication issues develop the ability, if they had it, if they weren't deaf, to communicate more clearly and more effectively, and to recognize cues and social cues and task requirement more effectively. And for people that were deaf with autism, he came up with programs to help them also integrate into the social society by teaching them extensive sign language. And all of his research was geared at helping those people within Lanterman to become a part of a world that kind of didn't know what to do with them. And so he was responsible for being a part of the movement that showed people that people with autism and Down syndrome were not broken, and they weren't, in his eyes, they weren't even disabled. They had different challenges. And so compassion and love for the autistic and disabled community kind of runs in my family, and I have a great example of someone who worked hard and was dedicated to these people because he loved them and he believed that they were capable of everything that we are. And so that's always an inspiration to me, and it's always something I consider when I talk about autism. So the medical advancements, currently there is a clinical trial for a drug called arbaclofen. I'm hoping I'm putting the inflection on that correctly. But it would be the first medicine to treat autism's core symptoms, which is social communication disability and repetitive behaviors. And there's a lot of compelling evidence now about intensive early intervention programs. So basically, when we know that someone has autism, we start at an early age intervening and providing them with additional social structure and help, so that by the time that they're older, they're following up pretty closely with the developmental stages of people without autism in communication and social skills. Autism acceptance is so important, and there are a couple of organizations that we want to introduce you to that are the leading champions of acceptance and tolerance for the autistic community. The Association for Science in Autism Treatment, ASAT. It's one of the leading researchers. It's a nonprofit organization for parents and professionals that are trying to get the treatment, care, and education for people with autism that they deserve. And then there's the Autism Research Institute. It was founded by Dr. Rimlin, and the Autism Research Institute is all about methods of diagnosing, treating, and preventing autism. So they're very, very scientifically based. They're always doing clinical studies and research. From what I understand, they're one of the more well-respected research institutes in the field of disability. And then the Autism Society of America. This exists to help people without autism understand the autistic community better and to be introduced to people on the spectrum and see how they live their lives. And it's an advocate for making sure that we do include them in our social status and our social sphere. Just because they have autism, they're not different. And autismspeaks.org is a great website to go to if you have any questions about autism. And then there are also useful assistive technologies like enabling devices, language acquisition through monitor planning, and Tech for Everyone. All of these technologies can be very helpful in helping integrate students into the educational system. They're neurological, they're developmental, and they help the students they give the students the right tools which will help them integrate better into social settings and into public schools. And we just want to close by saying that we are so grateful for this opportunity we've had to study autism, and we're grateful for the opportunity that we've had to have our own questions answered and our own misconceptions cleared. And we know that people on the spectrum are just like us, and in a lot of ways they have strengths that we just can't have because of their disability. And we would really like to view people with autism, like we said at the beginning of the presentation, as always unique, totally intelligent, and less mysterious now after this presentation. So we hope that you've enjoyed the presentation, and if you have any additional questions, you've got the websites. Go and do some research and include as much as you can.